family planning methods. Thank you very much.
That's amazing. Thank you so much, Ma. And I think you actually helped with some answers to the next question that we're supposed to ask also about the risk that are involved. But I want to ask you, Dr. Anutowoju, because one thing that I've also heard a lot, and also based on the research that was carried out by what organization and some of the result they get is how women now, it's on women, more scared, but also how families are afraid of, family planning method because some think it causes cancer, some things it can lead to infertility, especially for people that they still want to have babies. They just want to, put a break to kind of, okay, just plan how to have these children. So what do you think about this? Are there really some risk involved when it comes to family planning method, like big risk, like cancer, death, infertility, and all of those? What do you think about that, Ma?
Thank you very much for that question. So, like it's been said earlier, that there are some risks that are known, and that is why taking an individual approach for everyone is very important. You understand, to be assessed as an individual, the person's risk, family history, what's the person has comorbidities. These are the things that will influence or determine the choice of the contraceptives use. So yeah, there are some risks. Some are minor, like Dr. Ayola said, she said headaches, nausea, and some of those things just happen when the person starts using the contraception. So for example, if somebody is already obese, do you understand? And hormonal contraception will make her, the risk of weight gain and all that. So for somebody that is obese, hormonal contraception may not be optimal for her because she's already obese. She's likely to do what? Gain more weight. You understand? That's why we said and emphasized on an individual approach. So yes, there are risks, some minor, some major. Major in the sense that you really have to consider your options. So minor in the sense of headache, nausea, like she said. Some people, when they put an IUCD, they notice excessive bleeding. But with time, the bleeding, just normalizes. So if it just happens 1 or 2 cycles, you're putting the implants the last week or something, and then over time the symptoms stop, then that is all. But there are other major risk factors like blood clot, and that's, blood clot forming in the vessels. So there are some people who would have a higher risk of having that. Somebody who is obese already has a risk of having blood clot in the vessel. Somebody who is immobile, somebody who is not so active. So that kind of person going on a hormonal may not be the best because you are compounding the person's risk. You understand? That's why I said individual approach in making an informed decision is very important. And we also looked at, there's something we call hepatic adenoma. That's just, a growth in the liver and all that. It's also been associated with people who use some contraception. But this is not to scare anybody, but just giving an informed information. You understand? So that if you're making a choice, you have all the information and then you can make what the right choice. And for those that think, okay, contraception causes cancer and all that. And that's why they will ask for a family history. If you go to the proper place to have contraception, a contraceptive device or that service done, they will ask specific questions, you understand? Because yes, because of people who have to take estrogen in their contraceptive pill. So somebody who has a family issue of breast cancer, that may not be the optimal, contraceptive method to use. So while there are risks, they are not risks that cannot be handled. They are not risks that cannot be, managed in that sense. So what should be done is you want to do contraception as a family, a couple has agreed, okay, what are our options? What do we know? And then the options are tabled in line with the person's risk, whether health risk, whether comorbidities, and other things that will now help them make an informed decision on what choice to make. Thank you very much.
Amazing. Thank you so much, Ma. And before you leave, I have a follow-up question for you.
Okay.
Yes, but you did great justice to that question. So thank you so much. as we've talked a lot about the risk now, I also want to ask that, are there any benefits? And, Dr. Adidayo, where you already told us about the benefit of some of this benefit of family planning in a sense, but are there any specific benefits of family planning on health specifically now?
All right. Yes, thank you very much. Fundamentally, a woman carries pregnancy, well, we know husbands are supportive and all, but fundamentally, a woman does the job, okay? So contraception helps a woman, like Pastor said earlier, helps a woman's body recuperate, so you go back to your pre-pregnancy state. Because when a woman is pregnant, cardiovascular system, all the systems of the body are they have to do the job to cater for the fetus in the uterus, okay? So the family planning helps a woman's body go back. You have recuperated, you're in this state of you are feeling more healthy, and all that, to help you be able to navigate, okay, when am I having my next baby and things. So fundamentally, I think a woman is at the receiving end of that benefit, so that the body is not under undue pressure, and then your body, okay, I once had a patient, I think when I was doing house job and all that, she's always had rheumatoid heart disease. But what tipped her off, and then her heart failed finally, was a pregnancy. She's carried it for years. Do you understand? Then she had a baby, and then the whole system just broke down, and she never really recovered. So what I'm trying to say in essence is the first benefit, of course, and by extension, there's a benefit to the mother, the child, and the family and the community at large. Okay, and of course, some of these hormonal pills are even protective against some kind of cancer. You understand? So it's not all negative information and all that, if I can use that word in quotes. Do you understand? Some pills are protective against endometrial CA. You understand? Of course, the high estrogen may predispose to breast CA and all that. So it's an informed approach that will help people make the right decisions. Okay, so there are a lot of benefits to the mother herself. You can space your job. You want to do a master's program. Of course, it's wisdom to space. So you're not under undue pressure. You can make career progress and other progress, even in destiny life. You can't have 3 children. You understand, and face your destiny. You can't have 3 children that's 1 year between them and face your destiny squarely. That's the absolute truth, because you'll be under a lot of pressure to take care of 3 children in taking care of children. Of course, they are young, they are dependent on you and all that. Even as a father, there's of course financial pressure. Taking care of 3 children that are 6 months or 1 year apart is a lot. So there are benefits in the light of the mother, the child, the father himself, and the family. Of course, Pastor mentioned some of those things, so I don't want to go over them. But for the specific health benefits, it allows the mother recover, so that she can take time and plan. And then some of these hormonal are preventive against some cancers, but of course it's the balance, depending. It predisposes to some, it prevents against some. Okay, so all in all, it's an holistic approach. You understand, that will help people make the right decision, weighing the risk-benefit ratio. So weighing the risk, and of course, if the benefit is more than the risk, why not? Thank you very much.
Thank you very much, Ma. That was really, really well explained. And before we go to the next question, I just want to mention that we've heard that there are some people that were unable to join us because we are at our capacity on Zoom for some time now. But now we have our live streaming going on YouTube and on Facebook, and the link has been posted on the chat. So if you have someone that wanted to join that couldn't, please just share the link with them, and they will be able to join us. So you have the privilege of coming first. And I hope you're enjoying. So thank you so much, Ma. That was a very thoughtful answer and well explained. And I think one thing we've heard a lot from our panelists is that this is a very holistic approach. Dr. Anutowoju said it, Dr. Ayola Ojo said it, Dr. Adidayo also said that, this is something that you have to look at everything together in order to make the most the best decision for you, for your body, for your health, and for your family. And so this brings me to this question, Dr. Adeniyi, how can someone know or choose the best family planning methods? And please, we want it to be very I don't want to say layman language, but in a language that everybody can understand. What are the step-by-step approach that one can do to really know what would be the best method for them to choose? Thank you, sir.
All right, thank you very much. So, and like you said, I'll try to make it simple. Of course, one of the first things is to decide that you need contraception. You want to plan your family, and also decide how you want to plan your family. Do you want a long-term thing, a short-term thing, or a permanent thing? That that will determine which of these methods you'll be going for. Now, the other things that would come into play is your general health status, which Dr. Antoju mentioned. Also, the risk that are involved, your age, the family history. And these are the things that you need to consider when you want to choose the method. Now, the other important thing is, and somebody had mentioned that, is you don't just pick your choice from the streets, not just from conversation with your friends or what you read on social media. It's always good to talk to a health provider, because there's something we call medical eligibility criteria. What that means is that based on your condition, based on your status, which of these methods will be suitable for you. Now, this is where a lot of people miss it. They just think, my friend is using IUCD, and I'm going to use IUCD. No, that may not work for you, all right, based on situations and circumstances that you must have found yourself in. All right, so these factors must be taken into consideration. As law, for example, IUCD is very effective and can be used long term, as much as 7 to 10 years for some people. But if you have distortion in your uterus, in your where the IUCD will be placed, then the risk of failure is going to be high. So you will not want to use that. Okay. If you have some infection as well, we will not want to put that in, we don't want to use that, because there's a risk that can potentiate and cause the infection to spread. So you must know yourself. For example, if you are not very good at using drugs, a lot of people don't like using drugs. If you don't like using drugs, that means pills are not your option, because definitely you would not be faithful to it. Okay. So there are many things to consider. And so when you talk to a healthcare provider, look at your situation, look at your circumstance, look at what you are looking for. If you have decided, I don't want any more children, then the best will have been to go for a permanent contraception. And like Pastor said, it doesn't have to be a woman that is always going for the permanent one. I know a couple, they both decided the woman was going for a tubal ligation, and the man also decided to go for a vasectomy. So it's on both sides, because they have decided they have 2 children, they don't want any more. So for those people, it will be, you are tempting them negatively to suggest any other option. Okay, so we counsel them. Now, sometimes it's very tricky. For example, somebody can come at let's say 20 years, maybe if I had even given birth to and says he wants contraception, wants permanent. Now that we have to weigh that a lot, because there's something we call the risk of regret. You may feel like I'm